Metabolic acidosis occurs when the body produces too much acid or the kidneys fail to remove enough. Patients often demonstrate Kussmaul respirations, which are deep and rapid breaths as the body attempts to compensate. You might also observe confusion, lethargy, or signs of shock in acute cases. The underlying pathology involves a decrease in bicarbonate levels, pushing the blood pH below 7.35. This can result from diabetic ketoacidosis, renal failure, or the loss of base through severe diarrhea. As hydrogen ions accumulate, the respiratory system works overtime to blow off carbon dioxide. Nurses must prioritize treating the root cause, such as administering insulin for DKA or preparing for dialysis in renal failure. Continuous monitoring of arterial blood gases and potassium levels is essential for safety. Ensure adequate hydration and administer sodium bicarbonate only if specifically indicated by the provider.